Hi, I'm Miriam Cates. I'm the Member of Parliament for Penistone and Stocksbridge. The coronavirus vaccination programme is the biggest vaccination programme in NHS history. Even though we've rolled out nearly 4.5 million doses already and we're well ahead of other European countries, it's still going to take some time to vaccinate all adults in England. So I've been receiving quite a lot of questions about the rollout and concerns about how quickly it's going. And also I've seen quite a lot of misconceptions floating around on the internet. So I thought I'd do a video to address some of those myths and set the record straight. Myth number 1, our area is being left behind. Well, as of the 14th of January, the North East and Yorkshire was actually the second highest vaccinating region. We've delivered over 433,000 doses so far. Nearly 50% of those people are over 80-year-olds and the rest are NHS and frontline staff. So we're absolutely not being left behind. We're doing really well with the programme in this region. Myth number 2, we're not getting a mass vaccination in South Yorkshire. Actually, the plan is for Sheffield Arena to become our mass vaccination centre and it should be vaccinating by the end of January. But actually at the moment, supply of the vaccine is the issue. So even if we did have a mass vaccination centre running right now, it wouldn't affect the number of people who have been and are being vaccinated. Some people in our region may have received a letter from the Manchester Mass Vaccination Centre. If you're able to go there to get a jab, then you should respond to the letter. But if you're not, you'll still get invited by your local GP and it won't make any difference to whether or not you get the vaccine. Myth number 3, my GP practice should be vaccinating people every day. Well, at the moment, as I said, it's the supply of the vaccine that is the issue. This is a new manufacturing process. It's going to take time to build up enough supply to get more deliveries and more people covered. So as GPs and healthcare centres are delivered these vaccines, they are vaccinating people as fast as possible. But they don't have enough vaccines at the moment to vaccinate people every day, 7 days a week during all their opening hours. So just because a GP practice isn't vaccinating today doesn't mean that it didn't vaccinate yesterday or it isn't going to vaccinate tomorrow. But as I said, the supply is the issue at the moment, and as that increases, the number of vaccinations happening will speed up. Myth number 4, NHS workers and frontline staff aren't being prioritised. That is absolutely not true. They are in the top priority groups, and I know for a fact that thousands of NHS workers across Sheffield and Barnsley have already been vaccinated, and this is continuing all the time. Myth number 5, it's unfair that people in their 70s are getting the vaccination ahead of people in their 80s. Now, there's a strict order of priority for people and which groups get the vaccine in which order. And it's based on who is most likely to become seriously ill and sadly to die from coronavirus. And that's why the priority list states that we're starting with the most vulnerable, those in care homes, moving to the over 80s and then down through the age groups. Now, because we're a big country and we've got thousands of centres operating vaccinations, each of those centres is responsible for following the priority list. So as they get their supply of vaccine, they contact their priority 1 groups first and move down through the groups. Now, that means that because different areas will have different numbers of over 80s compared to over 70s and they'll receive their supply on different dates, it will be the case that some areas finish or get near to finishing all their 80s and move on to their over 70s before other areas have completed their over 80s. Now, that is absolutely unavoidable. It doesn't mean that it's unfair. Everybody's following the prioritisation list. And actually, if you think about it, if you waited for all the centres in the country to finish all their over 80s before anyone was allowed to start their over 70s, it'd be incredibly inefficient and it would really delay the rollout of the vaccine. And of course, what we're trying to do here is vaccinate as many people as possible, as quickly as possible, to reduce the spread and relieve pressure on our hospitals. Myth number 6. Celebrities are getting their vaccines ahead of their turn. That is absolutely not true. We're following the order of prioritisation, as I've just said. If there are celebrities who have received the vaccine already, like Her Majesty the Queen, it's because they're in one of those priority groups. And you might have seen yesterday on the news that Matt Hancock, the Secretary of State for Health, is now having to isolate because he's been in contact with somebody who's had the virus. He hasn't had the vaccine, neither has anyone in government or any celebrity that isn't in one of those top groups. Myth number 7, we're not being given any information about local vaccination rollout. The government has committed to giving daily figures about the number of vaccination doses administered and a weekly report with more information. We can also see quite a lot of regional data and the government has committed to making more and more available as it's collected. But of course, the truth is that reporting and collating this data does take a lot of time, and we would rather that our GPs are using their time to deliver the vaccine and other vital healthcare services rather than spending hours and hours a week reporting. But as I said, the data is improving all the time and anything that's available online is there for everybody to see. Myth number 8, no one at my GP practice is getting vaccinated. Now, not every GP practice is administering the vaccinations. GPs are organised into primary care networks, which are groups of GP surgeries that are working together to deliver the vaccine. So what you'll probably find is that one practice in each primary care network is used as a vaccine site, and that vaccine site will vaccinate the priority groups from all of the GP surgeries in that area. So just because your surgery isn't doing the vaccinations doesn't mean that over 80s and those at care homes in your GP practice aren't getting the vaccine as quickly as everybody else. They absolutely are. But the situation in Barnsley is slightly different. There's only one primary care network in Barnsley that covers all the practices. So there are 4 vaccination sites in Barnsley, but they're inviting people from all over Barnsley at the same rate. So if you live in Barnsley, you'll be invited to one of those centres. Myth number 9, now I've had my vaccination, I'm immune. This isn't true, and it's really important to remember that it takes about 2 weeks for immunity to develop following that first jab. So you're absolutely not protected the minute that you've had the vaccination. Also, although there's strong evidence to show that the vaccine will protect people who've had it from catching coronavirus and becoming seriously ill, after the 2-week period, obviously, we still don't know if having the vaccine stops transmission of the disease. So we're still in a national lockdown. Please stay at home, follow the government guidelines, hands, face, space. There are lots of other answers to frequently asked questions about the vaccine and other coronavirus issues on my webpage, www.miriamcates.org.uk. So please do have a look there.